Today, Carl Berry is the Executive Director of Community Resources for Independence, here to talk to us today about that organization. Welcome, Carl.
Well, thank you very much for having me here.
Nice to have you. Yeah, tell us about your organization.
Sure. Community Resources for Independence is a nonprofit social service headquartered right here in Erie, dedicated to supporting people with disabilities, intellectual disabilities, physical disabilities, the aging, whatever it might be, who have a common desire to live independently in their own home and in their own communities. Nothing wrong with nursing homes. They're appropriate for the right situation, but a lot of people, if they had a helping hand, they'd be able to live in their own homes, their own communities, and lead a, let's call it, a normal life.
Yeah.
That's what we do.
And thrive. We want them to thrive.
And how many people do you serve in the local area?
We serve approximately 1,000 people across western and central Pennsylvania.
Okay.
How long have you been in the area? How long has this organization and its services been available?
Community Resources has been here since 1990.
Okay.
Wow.
Good
And,
long
and
time.
how far is the reach? You said central Pennsylvania.
We go all the way over just north of Harrisburg.
Wow.
Terrific. You've got some funding concerns that you want to talk a little bit about
Certainly.
today. Obviously, that's how you survive and how you continue to provide resources.
Absolutely. In-home care for people with physical disabilities has simply not, the rates have simply not caught up with the cost of providing services. In the past 10 years, the cost of providing the services has gone up 44%, yet the rates paid to us have gone up about 10%. And it's been significantly underfunded. What that has caused is a shortage of caregivers. A lot of the individuals who have physical disabilities, who need a helping hand, rely on a caregiver, sometimes called a direct care worker or a personal care aide, to come in and help them with everyday things such as transferring out of bed, getting dressed, getting bathed, having a warm meal, all those things that you and I do for ourselves.
The day-to-days.
Not only that, but it also enables simple human dignity. And because of the underfunding, there is a shortage of caregivers. There's approximately 133,000 people across Pennsylvania who receive this service. Without caregivers, well, they don't have the supports to stay in their own home, and they may end up going into nursing homes at 2 to 3 times the cost to the taxpayer. And of course, that's not where folks want to be. So my purpose here today is to build awareness in the public about the need for our state budget to include a rate increase for personal care attendants, so that our personal care attendants can have a living wage, receive benefits, do the work that they love, support the clients that they love, and those clients can stay in their own homes where they love to be.
Yeah. And what can our viewers do to help you achieve that goal?
Well, to achieve that goal, it comes down to contacting your local legislators. It is budget season, and saying, hey, I support a rate increase for the Community Health Choices Managed Care Program, specifically for the personal assistance service providers such as Community Resources for Independence and our employees.
And how does Pennsylvania stack up with this rate compared to some other states?
Oh gosh, interesting question. There was recently a rate study done by Pennsylvania, and they looked at the states contiguous to Pennsylvania, and we are unfortunately the lowest by $5 compared to West Virginia. West Virginia pays more than $5 per hour compared to Pennsylvania, and they have a significantly smaller tax base.
Sure, yeah.
Ohio, similar tax base, they pay about $9 more than the providers do. If we had more money, we'd be able to pass that money through to our employees, because what else are we going to do with it?
Right.
Yeah, and that's what you need.
All right.
If you'd like more information, you can go to the website. There's crinet.org for information about Community Resources for Independence, and get a little bit more information. Feel free to give them a call if you'd like to know maybe what else further you could do to help, I would imagine.
Thank you very much.
Thanks
Yeah.
for sharing all that.